Hello everyone, welcome to sqadia.com. Dr. Hina Khan, and today the topic of our lecture is the eye examination. So today we're going to start off with a subject of ophthalmology. It's basically the subject or the branch of medicine and surgery, and it's dealing with the ocular diseases in primary motion. So we're going to talk about these diseases, but first of all, the eye examination is the first step. When you have a patient of ocular diseases or you're working in an ocular OPD, you're going to start off with the eye examination. We are going to study the eye examination steps in general over here in this lecture, and we're going to focus on the ocular anatomy. Now, knowing the ocular anatomy is also the basis of the study over here. If you don't know the normal structures that are lying in the eyeball and the preauricular structures as well as which are lying in the close vicinity of the eyeball, it's again very important to know the muscles that are attached to the eyeball for the eye movements. So we'll be studying the ocular anatomy over here. In the very first section, we'll be discussing the eye examination procedure in general, first of all. The steps of the eye examination procedure will be discussed over here, starting from the inspection of the patient. First of all, you're going to introduce yourself to the patient well off, and then you're going to start off with the inspection of the eyeball. It's the first and the major step of the eye examination, and then we'll move on to the important landmarks of the eye. As I've already discussed the point of view that knowing the ocular anatomy is the mainstay over here. So we're going to look, and we're not just going to start palpating or the percussion or the slit lamp examination start on. It's going to be a slow and steady procedure starting from the inspection of the eyeball. So in the very second section, we're going to move on to the ocular anatomy. So the normal terminologies, when we are displaying or when we are discussing the ocular diseases, one should have a core knowledge of the normal ocular terminologies that we're going to use. So the basic components of the eyeball will be discussed over here in this section, and then we'll move on to the discussion of the extraocular muscles. It's again very important to know these extraocular muscles. Obviously, we'll start off with the naming and the location, the origin and insertion will be discussed, and then we'll be moving on to the nerve supply, and finally, the action that is produced by these extraocular muscles will be discussed over here. In the third section, we'll be discussing visual acuity. So visual acuity is the mainstay. Working as an optometrist or working as an ophthalmologist, one should know how to examine an eye and how to calculate the visual acuity of an individual. So we'll be discussing the techniques of the visual acuity over here, and moreover, we'll be discussing the Snellen's chart, which is the most famous chart available for the determination of the visual acuity. That is basically the clarity of the vision in a patient. Then we'll be moving on to the extraocular movements over here, and we'll be discussing what can be the diseases that are related to the extraocular movements depending upon the muscle that is involved. It can be the nerve damage, or it can be the muscular damage or trauma to the eye that is causing these extraocular movements to be disturbed in a patient. Then we'll be moving on to the visual fields. Visual fields are basically the range of the vision that is available to the patient, and normally we divide this visual field into the temporal and the nasal vision fields. So we'll be discussing the difficulties that can be put forth to the patient by any nerve damage, and that is going to affect the visual field of the individual. It can be a peripheral visual field problem or a central visual field problem. We'll be discussing that over here. How do you basically assess these patients is again very important, and the pupillary responses are sometimes responsible for a particular kind of a visual field damage, and we'll be discussing that over here as well. So in the fifth and the final section, we'll be discussing fundoscopy. Fundoscopy is basically examination of the fundus of the eye, and it's basically the optic disc is examined along with the retinal veins and the arteries. They are examined on the fundoscopy. It's usually carried out by an ophthalmoscope, and we'll be discussing the parts of the ophthalmoscope over here and how to hold an ophthalmoscope, and obviously what's the technique of carrying out this ophthalmoscopy, which is also known as fundoscopy, will be discussed over here. The observations that are usually seen on the fundoscopy, we'll be also discussing them. Depending upon the diseases that are present in a patient, there are different findings on the fundoscopy or in the fundus of the patient. So we'll be discussing them as well in this section. So I hope you want to learn more about this eye examination. So do watch the other sections to this lecture as well.